I
Okie
have put
dokie.
makeup, but I'm ready.
All right.
Okay.
Okay. So, first question. Why did you decide to go into this profession?
Oh, that's a good question. You know what? When I first started, I didn't have no idea
Mm-hmm.
until I graduated from high school,
Uh-huh.
and I didn't know where to go. And I knew this lady by the name of Kathy Thumber,
Uh-huh.
that she told me you can go easily to Brightman campus, and that's where I graduated from medical assistant.
Uh-huh.
So, and then after, I have no idea how it's gonna be.
Yeah.
But then as soon as I start my classes, I love it, and that's what I've been doing all of my life.
Cool, cool. So, like, for your training, you just went into a regular community college, or did you take extra classes after?
No, that was like how can you say that was like right. I don't know. I don't even know if that exists still on wheelchair, but that was more like a college. But it was like a short how can you say a short the classes you take 2 times and you didn't spend that much time in school. Let's put it that
Mm-hmm.
way.
Yeah.
And then after that, you have to go and do your extra.
Mm-hmm.
And then when they receive the papers that I did all my hours, then that's the time they certify you.
Okay, okay.
Mm-hmm.
So, for your responsibilities, what did you have to do at your workplace?
Right now, when I first started.
Throughout your whole career, what was the main
Oh, yeah.
responsibilities you had to
Oh,
do?
yeah. Everything that's related to taking care of the patient,
Mm-hmm.
and that will include vital signs.
Mm-hmm.
Vital signs, triage the patients to the room,
Mm-hmm.
and with that will come the vital signs. Recheck medications or add medications into the system.
Mm-hmm.
Check for immunizations.
Mm-hmm.
We do ear lavage, which is removing the wax from the ears, which is called ear lavage.
Mm-hmm.
We do EKGs.
Uh-huh.
Well, I used to do X-rays and all that, but that's totally different. But yeah, that would include injections. What else? What else do we do? Calling medications into the pharmacy.
Mm-hmm.
And sometimes we do like a check-in, when the patients come into the window.
Yeah.
You have to check in the patients and check up the patients, order any medication to the pharmacy, send them for any testings like blood work,
Yeah.
or X-rays, MRIs, and what else? And now on these days, back then we didn't use any EMR.
Mm-hmm.
But on these days, you have to go for training for EMR, which is that electronic medical records. Everything is in the computer. We don't do papers anymore.
Yeah.
And for that, you need to be certified of, how do you call that? Taking a training classes to every time you give an injection, or not injections, but the vaccination.
Yeah.
Because we do vaccinations, like a flu shot, now with the COVID and all that, you need to record that internally, like in the whole USA.
Mm-hmm.
So you have to take extra classes with the Nevada state.
Yeah.
Mm-hmm. So do you need the name of that? I do have the name of that, but I have to look in. Yeah, I look right now.
All right. If you can, if not, it's okay.
Yeah,
So
that way you don't have to write all that. You just write that certification, what you need to be certified for.
okay, that would be nice.
I used to have it. Let me see here. And I don't even know. What else do I do? Translate English to Spanish or Spanish to English.
Mm-hmm.
That was another part of my job.
Oh, it's interesting. So you had to really use your communication skills there to be able to help the patient, right?
Definitely, yeah. It's better if you're bilingual. That's for sure.
Yeah, I know.
Especially when you work. I was lucky that I used to work with. The first doctor that I used to work, it was Colombian, so I didn't do much of that. Oh, and I used to do scribing. I forgot about that. my last job was scribing. I go in with the patient, with the doctor,
Uh-huh.
and I type everything for the physician. I'm the one that sends the medication because my doctor didn't know how to use the computer and he didn't want to get trained for that.
Yeah.
Because that was a different training. So I'll practice what I was, doing his job.
Yeah.
until he decides to resign. And it's a lot. Plus on that, you have to be updating your CPR.
Mm-hmm.
Every 2 years, you need to get your TB test. You need whatever, all the requirements. You have to do that when you're working in with a physician or in a medical clinic.
Oh, okay, interesting.
It was fun.
Yeah, no, I bet.
And on top of that, drawing blood, sending to the lab, and all that.
Yeah.
Sometimes there is insurance that we can do in house, and there is insurance that you have to send them out to go to Quest or LabCorp, different places. Mm-hmm. So
you had a lot of responsibilities.
it was so many things, and right now I'm just doing personal care. I'm just working like a part-time from my house because I've been having so many issues with my health.
Yeah.
Which is not as fun as before, but it's a lot less stress.
Yeah, I imagine.
Yeah. Mm-hmm.
So, when you would get a new patient into the clinic that you were working at, what did you have to do to evaluate them to see how their health was, their current health?
Well, you need to take the full history.
Mm-hmm.
Ask them what's the reason for them to be there, and not just that, obtain their medical records from the previous physicians, so previous offices that they've been through, specialists, or any physical therapy. So that's how you start the patient, and then go to chief complaints, which is asking them what's the reason for them to be there, and on that you have to add all their diagnosis, all their medical problems. Yeah.
So after that, you were able to track their progress as they were there, right? In case they had an illness or they had a problem, you were able to track it based on those medical records,
Absolutely,
right?
yes.
Interesting. And I don't know, but did you ever have patients that were kind of hard to work with, that weren't motivated?
Oh, yes. We usually, that's the most common. We get non-compliant patients, patients that come to the office and they've been advised to go get some testings done or keep taking their medication in, daily routine, and they just don't do it. And then they get upset when they come back and they're not getting better, or there's no way to continue with their treatment because they haven't do the testing that they're being asked to go and get it done. Yeah.
So were you part of their motivation system too? Did you have to?
Yes, we have to call them and tell them what's the reason for them to go and get those tests done, because usually when they don't go and get the test done, they tell us patient didn't schedule this appointment.
Yeah.
We contact patients so many times, no answer. Or a pharmacy will call us and say patient's not picking up the medications.
Yeah.
So that means they come to the office and say, I'm taking the medications, but now in these days we can check all the medications that they're on, and they cannot come and say, oh, I'm taking the medication, or I'm not taking anything, because you go into the system and everything's in there.
Yeah, it's much easier nowadays.
Yes, so that's how you get them, you know what I mean?
Yeah. So, I know you've been in this profession for a lot of years, but if you could improve something, probably from your learning or anything you've done with your patients, what can you improve?
What do you mean by that?
Let's say you see you probably had difficulties with something during your career and you wanted to improve it. What would you do in a way to improve that?
Well, we get evaluated every 3 months.
Yeah.
And by that, when you go into the office with the office manager, they'll tell you what you're not doing good. For example, what was one of my witness? Let's see. Probably not participating on many meetings with them, or not going to the stations with the patients. And the reason for that is because I didn't have the time. I was doing so many tasks. I was assigned so many tasks that I couldn't. So sometimes to improve that, I just ask them if they have someone to cover me, and then I will be able to go. But really, I didn't have that many problems. No.
Yeah, that's good because I hear some other stories where they're like, they struggled with this, they struggled with that.
No, thank God I did not. The EMR was kind of hard for me because, now in these days, most of the people that's working in the